fighting in Syria doesn't just kill with bombs and bullets. The violence has now put hundreds of thousands of Syrian children at risk for a nightmare disease that was thought to have been virtually eradicated long ago: polio. The last time polio was detected in Syria was more than a decade ago in 1999. The World Health Organization confirmed on Tuesday 10 cases of polio inside Syria and said there could be more. The WHO says before the civil war broke out, 95% of Syria's children had been immunized against polio. In 2012, that dropped to 68%. Now an estimated 500,000 children in Syria are at risk. UNICEF put out a global appeal for Syria's immunization program.
The conflict in Syria has caused immense displacement, with millions of children on the move, either inside the country or across borders into neighboring countries and beyond. As a result, routine immunization systems so critical to preventing childhood diseases have been disrupted or broken down.
For many, polio is a disease of the past, a highly infectious virus that attacks the nervous system. 1 in 200 infections leads to paralysis, usually in the legs. Up to 10% of victims die. In many countries, polio has been virtually eradicated by mandatory vaccination programs, and Syria was one of them, but no longer. UNICEF and the WHO are now struggling to vaccinate hundreds of thousands of children with the help of the Syrian Ministry of Health. But with so many children fleeing the violence and with so much of the country inaccessible because of the fighting, aid workers are racing against time to stop the virus before it spreads. Atika Shubert, CNN, London.